Okay, ladies and gentlemen, all protocols be respected. Good afternoon, and you're all welcome to today's webinar. We are welcoming those who are joining us for the very first time in this webinar series, and for those who had been in previous episodes, we welcome you again. Today we have an exciting lineup of speakers and a very interesting topics on our agenda to discuss on this webinar, Making Epilepsy a Health Priority in Africa series. We have 1 hour to be together, and I know that as usual, this 1 hour will be very impactful, especially as our goal today is to get our advocacy right. And we will be launching the International Bureau of Epilepsy, African Epilepsy Advocacy Toolkit. We have 1 hour to be together, and I pray we all make it count. Without much ado, I am Comfort Musa, and I'm joining you from Yaoundé, the capital city of Cameroon. I will now hand over the floor to Action Amos. He's the International Bureau of Epilepsy Vice President, Africa.
Thank you, Madam Moderator. Comfort, as has already been mentioned, I'm Action Amos from Malawi, and I'm the Vice President of International Bureau of Epilepsy, the African region. I want to thank you all for making time to be with us today as persons with epilepsy. We do not take this for granted. Let me give a special recognition to my mom, to my mentor, Her Excellency, former President of Malawi, Dr. Joyce Vanda, and also to someone special as well in the epilepsy movement, though I'm told he's on his way to join His Royal Highness Prince Bandzile from Eswatini. As a person with epilepsy myself, I'm quite excited with the event of today, where we are launching one of the tools that we'll be using in our work. Today, actually, it's a double celebration for us. As you can see on the lineup of those that are on the panel, they are all women. On Monday, we'll be celebrating the International Women's Day. And the theme of that day, it's Women in Leadership, Achieving an Equal Future in a COVID-19 world. We could not assemble any better leadership of people that we have in Africa than those that we have put together as women. I want to thank all those that will be presenting, and those that are representing women, and also to thank all women with epilepsy wherever they are. Some are following us on Twitter, some are following us on Facebook, and some are following us on different TV stations that are connected. We have about 4 TV stations that are connected. We want to thank you, our friends from the media, for the support that you continue to give us. As you know, we have one item, one agenda as persons with epilepsy in Africa, which is making epilepsy a health priority in Africa. Why health? This is just an entry point. We want to be everywhere, economically, socially, and politically. We want to live and see a day, one day, where we'll be talking about a president with epilepsy, a minister with epilepsy, a member of parliament with epilepsy, and those people be able to come out in the open and declare themselves as persons with epilepsy. Epilepsy should not be a barrier. So today we are excited with the work at hand, and also want to appreciate all those that were involved in the production of this advocacy toolkit, the International Bureau of Epilepsy, Executive Management, African AREC Committee, and the Toolkit Steering Committee, and all those that provided support. We want to thank you so much for all the support that you continue to give us. With those words, we want to welcome you all. Thank you, Madam Moderator.
Thank you very much, Action Amos. And today we're really excited to have with us Her Excellency Dr. Joyce Vanda. In the previous webinars, we had her contributions, but today what is special is that we'll be having her live presentation. And what is obvious to all of us is she was Malawi's first female president, Africa's second female president. But what you may not know is she's also an entrepreneur, an activist, a philanthropist. Also, on her first day, from her first day in office, enacted the disability bill in 2012. So epilepsy is a disability in Malawi that's recognized. So her commitment to making epilepsy a health priority did not stop now, and we're going to be tapping from that wealth of knowledge and experience and commitment as we listen to her presentation now on epilepsy inclusion on the health agenda is not a matter of choice, but the way to go. Good afternoon, Your Excellency, Dr. Joyce Vanda.
Thank you. Good afternoon and warm greetings from Malawi, the warm heart of Africa. And thank you for that introduction. How I wish there was no COVID-19, and would invite you and all of you to come to Malawi and enjoy our lake and enjoy our fish and chambo. Did you know that if you get into Lake Malawi, you can increase your life by 10 years? That is the myth. I would like to begin by acknowledging all that are present here. Of WHO staff, International Bureau of Epilepsy team from different countries, any government officials present, and any media houses linked to our webinar. I want to welcome you and thank you for attending this webinar. A special mention goes to all people with epilepsy present here. I want to agree with our moderator and of course our vice chair that I don't understand why people, prominent people, decision makers with epilepsy come out, because that has an impact on people suffering from epilepsy, because they serve as role models, but for some unknown reason, people don't want to come out. I'm proud to be here today on the launch of the Advocacy Toolkit. Most of the times when we face challenges or problems, we usually leave these to politicians to solve them for us. We expect them to understand us, feel our situation from a distance, and assume that we all will be well. Let me tell you that it can take years before you realize the real change if you take that approach. In my experience as an advocate for women, children, and youth empowerment, I have learned that there has been need for us to stand up and voice out our concern. When I became minister, I now knew exactly what was wanted because of my experience. However, most of the times the politicians or governments have no information on our needs and wants. This, when our advocacy should come in and fill that gap. I'm excited that the Advocacy Toolkit to be launched is one tool that we all need. Personally, I've taken a look at it and noted some gems that can help you. Be creative and let the toolkit be your guide. Coming back to why epilepsy should be on the health agenda, think of this: in the most African countries, the average total number of voters will be around 5 million to 6 million. Of course, we are not talking about small countries like Eswatini, Botswana, or Lesotho. In Africa alone, we have over 10 million people with epilepsy. What does that tell you? It means we are a constituency on our own and we need to be counted. When the politicians are campaigning, take them to task as a group and hold them responsible. We are looking forward to have organized advocacy from village level. You must build your case using persons with epilepsy, like yourselves and those that support you. Guidance in the tools you are developing should help you in using the toolkit once it becomes operational. The toolkit is ours because I remember in October 2020, when I made a call to all member states that we needed them to endorse the World Health Organization Resolution 68.20, people thought it was just a one-off thing. I am passionate about epilepsy as a mother and as a former head of state. I'm glad now that we have the resolution endorsed and a global plan is being developed. I have first-hand experience to know what it means to see someone facing struggle of drugs. When I took over government in Malawi, there was a crisis of drug shortages in our hospitals. We did turn over the situation and I ensured that my government listed epilepsy drugs as a priority. I not only did that, but a few days in office, I passed the disability bill, which had not seen the light of day for 8 years. As you might know, epilepsy in Malawi is considered a disability, which meant that people with epilepsy would benefit. I'm excited that today we are gathered here to witness the launch of an ambitious project that started in June of 2020. And it draws on existing research and consultation from persons with epilepsy themselves. This is what we want to see, as it provides insights into the daily lives and lived experience of persons with epilepsy themselves. To all persons with epilepsy in Africa, take this as a challenge that you now have a tool to use to advance your agenda. No one, and let me tell you that no one will stand up for you. From my years as an advocate for children, youth, women empowerment, I can tell you that this is the time to increase your volume. Raise your voices. And here is my last tip for you as an advocate. Ensure women and children are included in your work. Talk about employment. Talk about discrimination and stigma. Talk about domestic violence. And talk about data availability. Any case presented becomes powerful if it is accompanied by data. As we all know that epilepsy is a health condition, there's a tendency to focus on health and forget other social and economic areas. I want to restate my area core, that we need more support on epilepsy in Africa. Let us join hands with all stakeholders and soldier on to ensure that epilepsy is a priority in Africa. Let it be known that advocate number one is the person with epilepsy, and then advocate number two is Joyce Vanda. For me, I am morally obliged to raise my voice on behalf of those families and individuals suffering and affected by epilepsy. When I was president, I mobilized fellow heads of state and hosted the first ever Heads of State Summit to fight intellectual disability. May I end my speech by making a global appeal once more for me and Malawi or any other country in Africa to host another meeting of leaders, to have a discussion on epilepsy and to draw an action plan for the next 5 years. Distinguished ladies and gentlemen, my commitment and passion for matters of disability is well known, not only in Malawi, but on the continent of Africa. It is not fair that we can call ourselves leaders and advocates when we leave a whole generation of people with epilepsy behind. I said this when I launched the fight against intellectual disability. And I said this when I took the matter to Parliament to pass the law. Immediately I became president on matters of disability in my country. And I say this again today. There's work to be done. And I want to promise all of you that it is my intention to work on matters of disability until the job is done. Thank you.
Thank you very much, Your Excellency, for that wonderful presentation and ending it on the note that we will stay committed to this cause until the work is done. That is the commitment we all are taking today as we seek to get our advocacy right all through the continent. We will have another message right now, the launch message. For those of you who are joining us and didn't have the background, today we're launching the International Bureau of Epilepsy African Epilepsy Toolkit. And on this special launch occasion, we have a message from His Royal Majesty Prince Bandzile, Patron of Eswatini Epilepsy Organization and founder of Africa Epilepsy Trust Fund. Good afternoon, Your Majesty.
Hello, good afternoon.
Good afternoon.
Thank you. It's a pleasure to be here. Thank you. Greetings, Your Excellency and everyone who's here. Firstly, let me thank all those who are involved in the production of the Advocacy Toolkit, the International Bureau for Epilepsy Africa chapters, the Toolkit Steering Committee, and the Advocacy Committee of IBE-Africa. I know that a lot of work had to be done and also a lot of resources were used for this production. I therefore want to thank Banda Foundation, specifically Cardinal Lafam, for the continued support that you are providing to epilepsy in Africa. Take this to the Board of Trustees and tell them that we are thankful and appreciate their support. To all advocates present here and those following us using different platforms, note that this is the beginning of systematic advocacy. Let us soldier on without letting up, just as Her Excellency Dr. Joyce Vanda pledged. I will always be available to support epilepsy work at any level. With that said, I am confident that with this toolkit, epilepsy work in Africa will never be the same. It is therefore my pleasure and honor on behalf of the International Bureau for Epilepsy Africa region and all its partners that I declare the Africa Epilepsy Advocacy Toolkit officially launched. I wish you well and please stay safe. May the good Lord bless us all. Thank you.
Thank you very much. And without much ado, we will be going straight into the panel discussions, but I ask for presentations and maybe links to some of the works that our speakers have done. Action Amos, I think resources we have. So I encourage you to follow to the bureau if you need more done. And please, when you are not presenting, kindly switch off your microphone. We have 4 panelists with us this afternoon, and please, when I mention your name, you can turn on your video. We have with us Sharon Mbugua from Kenya. Sharon is a person with epilepsy and a member of the Kenya Association for the Welfare of People with Epilepsy. She's also chairperson of the Mental Health Alliance of Kenya. The panel also, we have Dr. Florence Baingana, WHO Afro Region. Good afternoon, Dr. Florence. Is she on? On. And we also have Dr. Vicki Pinkney-Atkinson from South Africa. She is the Disease Alliance, and in which capacity she has also served since its formation in 2000, a rich portfolio that I may not be able, to read all. We will share more on our social media pages. And of course, we have Nkandu, Nchindila from Zambia. Hope I pronounced your name right. She's a lawyer, she's a writer, researcher, humanitarian worker, whose niche centers around human rights, international humanitarian law, and international criminal law and forced migration studies, and it's supporting the International Bureau for Epilepsy in Africa. So I have seen Vicki. Do we have Sharon, Dr. Florence, and Nchindila? Are they all here?
Yes, I am.
Oh, yeah.
Yes, we are all here. Yes, we are.
All right, great. So we're going to start with Sharon. In 2 to 3 minutes, we would like to hear from you the perspectives on the actions of governments, from the perspective of a person living with epilepsy in Kenya. We heard Dr. Joyce Vanda talk about the commitments she took in office, legislative, and administrators have a lot of power, to bring about the change. As a person living with epilepsy in Kenya, what is your assessment, of government interventions in the areas of concern raised by persons with disability in Kenya? What's your perspective of this, Sharon?
Thank you very much, Comfort, and thank you, Her Excellency, Dr. Joyce Vanda, and His Majesty, the Prince Bandzile. Let me begin by just saying how inspired I am by all the work that Dr. Banda had done during her presidency. And just to refresh the numbers that she mentioned, there are 10 million people living with epilepsy, which brings down the percentage to 0.01% in Africa. And specifically in Kenya, that's an estimate of 0.02% based on figures of 2017. And again, for our partners and media and all the people with us who may not be very clear what epilepsy is a neurological disorder, typically caused by nerve cell damage in the brain. And so, moving on to just a few words I'd like to say, we have many studies that looked at the factors behind epilepsy and what causes epilepsy. And I'll just focus on 3. The first is that our governments in Africa have not always supported us on the access to health services and medication. When you look at the continent, there's very few mental health professionals, that is psychiatrists and neurologists actually in the continent. And especially in rural Africa, we have so many people who are unable to access medication. The other point I'd like to talk about is either late misdiagnosis or late diagnosis or non-diagnosis, because we have cases, especially with many children, where many of them go untreated just because there was no proper diagnosis. In my case specifically, I was misdiagnosed with a heart condition. And if I think about how if I'd have gone down that route, I would probably be taking heart medication for a condition that I was recently diagnosed as 2 years ago as epilepsy. And so the last thing I also want to talk about is the productivity challenge that epilepsy brings, either to the individuals, to children, to family and caregivers. We have so many people who set aside what they need to do, what they want to do, as far as contributing to productivity in governments, in the nation. And I think that's just, it's really a challenge and really sad in my view that we have so many, we have GDP affected by so many cases. One more thing I'll just mention is the cases where people actually look for alternative sources for help. We have people who actually go to witch doctors. We have people speaking to pastors who believe that they can pray out epilepsy from you. And that is such an unfortunate situation, especially in a lot of rural Kenya and rural Africa. And so these are just some of the things where I feel our government, locally and continent-wide, have needed to step in. The WHA 68.2 resolution insisted that we need to have an integrated global action plan. And I believe we have Kenya as one of 47 African countries that ratified this. And so in closing, I would say that our governments have really failed us as far as making epilepsy a priority. And I would love to see a lot more public awareness about epilepsy and campaigns across the continent just talking about this. Thank you.
Thank you very much, Sharon, for not only letting us know how and where the government has failed, but in showing ways in which they can do better. And I think the call for us is to get our advocacy right, to make sure that these issues are addressed. Thank you again, Sharon, for sharing your experience and your thoughts on where the government has failed and what can be done better. From Kenya, we will go down to South Africa. Dr. Vicki. Dr. Vicki, as an advocate as a non-communicable advocate, what are some of the challenges you have working with the government in your advocacy, and what can be done for us to get this right?
Thank you so much, Comfort. All protocols observed. Thank you. I'm very grateful to be included here. So the issue is that really you don't want to take on your government head on as a policy. It's not the first step you take. However, there comes a point at which you've done everything to try and work with the government and you're getting nowhere. And this is a journey of many years to say where we've got to today. So we do specifically policy advocacy. And policy advocacy is we drilled it down to make sure that the laws and that the plans in our country and budgets all align to support non-communicable diseases, including those people living with epilepsy. And so at the end of the day, what we found is that unless we actually became very outspoken and we got our own facts right, and we put those facts and published those facts, we were getting nowhere. We are just beginning to crack the ice after 7 years of very, very hard work. You will recall in Africa, the most important agenda item in health in our country is HIV and AIDS and TB. And the budgets are there for that, the policies there for that. And you will also recall that people living with HIV and AIDS also had to take to the streets and to get what they needed. So we've got to do the same. We're not as well resourced in non-communicable diseases. So we have to, I have had to learn word by word, step by step, every policy that exists, the budgets that are published, And that's really how we've got it. Today, I am proud to say that we have a case with our South African Human Rights Commission for non-communicable diseases. We are taking our government on the case that it does not adhere to the same policy that it does for HIV and AIDS and TB. There is inequity. There's no funding for NCDs. And so we go. And then we have also now going into the National Planning Commission that has for the 10th year, I think it is, 7th year, it has not included NCDs as a priority in the National Development Plan. So now you can see where we're going. And the same thing goes down to every level. There are no budgets at a provincial level. So we're starting at the top and working our way down, and we hopefully are winning this. We've just had confirmation of a whole lot of showing the discrepancies between NCDs. So it's not just our word against the government. We've documented it. We've got stuff on the website. So that's all I want to say. It's a journey, and you've got to be tough. You can't give up. And there are many days when I want to give up. But you have to be tough, and you've got to keep going, because it's about us and our people, our beloved Africa, and our people need to be taken care of. Thank you very much.
Thank you, Dr. Vicki, and please, for the participants who may have some questions for the panelists, you can leave a question in the chat. We will take the number we can, looking at time, but please, if you have a question as the panelists share, you can leave a question in the chat, and we will take the ones we can, given the time we have. And of course, we're looking at epilepsy and the priorities as a human rights issue. That's why right now we're going to get Advocate Nkandu to talk to us about the implications, what implications are there for the non-prioritization of epilepsy from a legal perspective.
Good afternoon, everyone. Thank you so much for this platform. From legal perspectives concerning non-prioritization, there still exists legally and socially sanctioned practices which are based on primitive knowledge that are highly discriminatory against persons living with epilepsy. When health conditions are not prioritized in our laws in a manner that is progressive and reflects present-day evidence-based research and knowledge on epilepsy, persons living with this condition are left vulnerable to some of the dangers which Sharon alluded to, like disability and mortality, social exclusion, economic disadvantage, mental health outcomes, which are only perpetuated through the lack of clear policies and apt legal recourse. The right to health, as Dr. Banda mentioned, really does go beyond biomedical factors, and it encompasses a lot of social conditions in which people live and operate. And without the prioritization of empowering legislation and policies, as well as enforcement mechanisms, it is much harder for advocacy initiatives, including self-advocacy efforts. And these are some of the reasons which give impetus for concerted efforts towards including what has been determined by the international community to be a common public health imperative in our national health agendas and legislative frameworks. Doing so based on internationally accepted human rights standards can prevent institutional discrimination and deter rights violations. It can improve access to healthcare services and generally overall improve the quality of life for persons living with epilepsy. Now, where the right or the realization of the right to health is concerned, non-prioritization can be seen through the failure to enact or adopt and implement necessary legal and policy frameworks with appropriate right to health indicators. And these indicators should also have benchmarks in relation to each one of them. I think in this way, we are then able to monitor progress and to clearly articulate to oversight mechanisms where exactly shortcomings exist. From legal perspectives, we also know that, or rather it has been well established through international legal instruments such as the International Covenant on Economic, Social and Cultural Rights, for example, which many African states are party to, that everyone has the right to the highest attainable standard of physical and mental health. And even though the ESCR committee, which is the UN committee which is tasked with monitoring the implementation of the International Covenant, has determined that the obligations of states in this regard are to be progressively realized in accordance with available resources, it still remains critical that fitting legislative, administrative, judicial, promotional, and other measures are taken towards the full prioritization of health conditions like epilepsy, so that the most vulnerable amongst us are empowered to assert and claim their rights.
Sorry, I was muted. Thank you, Nkandu. Of course, there is a question for you. We'll come back to you later, but right now we're going to hear from Dr. Florence and Dr. Baingana. Hope I pronounced your second name correctly. Epilepsy and the experience for persons living with it in urban centers in Africa and in the villages. The experiences are definitely different because of different infrastructures and access to care and all of that. But what is your view on what governments can do when it comes to epilepsy, to make sure that there is a response that meets the needs of those who are in rural and urban centers on the continent?
Thank you for the question. First of all, I feel very honored to be here, to have been on this panel. I wanted to thank Her Excellency, Dr. Joyce Vanda, for the support she has provided consistently for decades. So that is what we hope all leaders could be. I also want to mention that my colleague from WHOHQ is also on here. Myself, I'm from the Afro office. My colleague Batu, who is from the WHOHQ office in Geneva, is also happy to be here with you today. Regarding the question, governments unfortunately have competing priorities, and especially so for those of us here in Africa, in the African region. The competing priorities include the conditions that have already been mentioned, things like HIV and AIDS and malaria. We still have children below the age of 5 years dying from preventable conditions. We still have women dying while giving birth. These are all things that could be prevented. And so we try very hard to prevent those deaths that we could prevent. We also have now the increasing numbers of people living with cancers and diabetes and other non-communicable disorders. So as the populations, as we go into that demographic shift and the populations live longer, then we have other non-communicable disorders, the ones that were the original 4x4 as put out by the UN General Assembly. And then mental health and neurological disorders and substance use disorders were then added to those. And so by that time, and I think Dr. Vicki outlined it very well, to to get to that point where you can actually advocate and see a result, it really takes time, because even as I think those who worked at the global level had to advocate very hard before we could get mental health and neurological disorders into the Sustainable Development Goals. We had tried with the Millennium Development Goals and that didn't happen. But keeping on and never giving up, we finally got it into the Sustainable Development Goals. And now the challenge is, how do we ensure that we actually follow through, because we shall be measuring progress made in 2030. And I'm not sure that very much progress has been made. Budgets, something that was mentioned again by Dr. Vicki, the budgets. We know that unfortunately our African governments do not have the resources or do not prioritize health. It could be a mixture of both, not having the resources because our tax base is so small, but also not prioritizing health. We tend to prioritize security, isn't it? But I will not go into that one. So our governments tend to put very little in health. And so that which is put in is determined by the priorities then that are funded are determined by the person who is willing to pay. So if the development partners are focusing on HIV and AIDS and malaria, if we have a big donor for that, we have PEPFAR, we have Gavi, we have those big donors bring in the funding that then funds those programs. The other big donor for our healthcare systems is actually the families who pay out of pocket. In many countries are paying up to 60% of the funds that go into the health sector, because they pay out of pocket into the healthcare systems, and the families often determine where they are going to pay. Some of them are going to pay into the healthcare system at the primary care level, but very many times they prefer to pay at hospital level because they believe they get a better service there. And for mental health and neurological conditions, they also very often begin with the traditional healer, and that's where they opt to put those resources. Definitely governments can do more, and governments are trying to do more, I believe. As many of them endorsed the resolution, many governments endorsed that resolution on epilepsy and neurological disorders, and governments endorsed the SDGs, and we're all working very hard to see how we can operationalize those. The biggest challenge was already mentioned, the challenge of human resources, the challenge not just of specialists, neurologists and child neurologists, but also the challenge of healthcare workers at the primary level who can be trained to then deliver this service. So if you have healthcare workers at the lowest level of care who are not professionals, it is very difficult then to train them to provide the care that should be provided. But we are working very hard to integrate mental and neurological disorders into primary healthcare and into community care. I'll stop there for now. Over to you.
Thank you very much, Dr. Florence. We're definitely going to come back to you with some questions. We will be going back to Dr. Vicki. And Dr. Vicki, we're looking at advocacy, and our focus this time is on the persons living with epilepsy in Africa. So what, in your opinion, is the best approach to ensure that persons with epilepsy take this agenda to the next level?
Thank you so much. It's an excellent question. And it, again, is not just a one-off and a one-day to start what you're doing today by launching your toolkit. And I've had a look through it, and it's wonderful, and there's lots of ways in which you can use that toolkit. But it starts with awareness, and people, and it will take strong leadership. And while it's nice to have healthcare professionals working alongside people living with epilepsy, the movements in Africa that I see, I'm really very sad. Many of us are run by healthcare professionals. I'm in the capacity as a person living with 20 NCDs. And so what we're saying is that the people, it's the voice of the people that needs to be heard. And in Africa, one of the difficult things is often connecting us because we don't have good bandwidth, you know, and sometimes we struggle to speak to each other. So I think we've got to be innovative, we've got to mobilize, and where there's a will, there's a way. And really, if you talk about mobilizing at a grassroots level, that's easier to do to start with than to be doing the policy advocacy, which will need some focus and some research and support. So I'm not going to tell you how to do your job. We have a brilliant Epilepsy South Africa, and we work with them and have worked with them for years. They are amazing. And they've formed a group with the disabilities. You've got to go and work with like-minded people. I think the biggest problem is if we make epilepsy also too standalone. We've got to find ways and synergies, like in universal health coverage, to make sure that we put mental health, epilepsy, all together in a proper package based on what's worked for HIV and AIDS, and then make people. It's integrated, person-centered care, and mobilizing the patients are the first ones to start. So thank you very much.
Thank you, Dr. Vicki. Dr. Florence, I have a question from one of the participants. And the question is, as WHO, what influence will you have to ensure that governments develop national epilepsy plans? And I'll just add another quick question to you as WHO. You mentioned the fact that in rural areas you have traditional healers, you know, and in towns you have modern medicine. Is there a plan to work with the traditional healers in these rural areas, you know, where they may not have access to modern medicine? So those are two questions for you. What influence WHO can have to ensure governments develop national epilepsy plans, and are there any plans to work with traditional healers in the rural areas?
Okay, thank you for those questions. And I would say, yes, there's a role and definitely there's a plan already underway for WHO to support governments, the member states of WHO, to do something about epilepsy and other neurological disorders. WHO is working on an action plan. So after that resolution was passed, WHO has been working on a global action plan for epilepsy and other neurological conditions. A working document has already been developed, and actually from today up to mid-April, it's going to be on the web, and I will share the link with Action Amos as soon as possible. As soon as I get the link myself, I will share it with Action, so as many people as possible can then go on the web and review that document, because that document is the one. That document is the one that states what each let's say WHO member states, even individuals probably would have something that they can do. So I think you should look out for that. We shall be having a regional consultation later on in the year, where we will bring together all the member states in the region to again discuss the same document. And I hope Dr. Joyce Vanda, Her Excellency, will hear this, because she had mentioned the idea of bringing us all together. So that plan is in the pipeline to bring member states together to have that discussion. I would say that working with traditional healers is a very complex, there are pros and there are cons to that, because I think because of how long we go through the training that we go through to ensure that what we do does no harm to that person whom we are treating, I think we do have to be careful, but there are countries that have managed to put in place a system for working with traditional healers, where traditional healers even sit in healthcare systems so that there's cross referral. Because most of our patients actually go to traditional healers first. People with mental and neurological conditions, even up to today, go to traditional healers first and only come to us later on or on the referral of a traditional healer. So the idea then would be, how do we work together with traditional healers so they refer the patients to us much faster, especially for conditions like epilepsy, where definitely we know that there are treatments that can be given and that can control the convulsions. I'll stop there for now. Thank you.
Thank you very much for sharing that with us. We have a comment here from Dana in Mauritius, and Dana says it's time that we work on a progressive roadmap plan, setting some achievable targets. We may not have control on our government or authorities concerned. However, by setting some proposed targets, like targets in priority education, vocational training, employment, and support, data support is mandatory and needs to be shared. And Dana's question is, how do we go about setting these targets? So that's Dana's question. I would leave it open to any of the panelists that would want to respond to that now or later. But in the meantime, I will go to Nkandu, Advocate Nkandu. Legally, what can now be done that we have the WHA Resolution 7311?
Most importantly, I'd say is the need to encourage states to build on the momentum that has been created through this public commitment to develop a global action plan on epilepsy and other neurological disorders. WHA Resolution 7311 calls on the international community to create an intersectoral global action plan for epilepsy and its synergies with other neurological disorders, outlining relevant multi-sector intervention pathways for government action and setting clear targets that all governments would commit to. And I'm so glad to hear from Dr. Baingana about the progress that has been made by WHO and how quickly and how promptly a draft plan can be shared. And I look forward to looking at that once it is shared. But herein lays an opportunity for African states and civil society agents to lead on inputs towards the global action plan through commenting and through engagement with the relevant stakeholders. An agreement at the international level is great, but this is the time for domestic implementing legislation and policies to translate and enact international commitments. It is also important to establish centralized monitoring mechanisms to track progress made on public commitments and targets. And I think that governments and civil society organizations have a continuing obligation to move as expeditiously and as effectively as possible on this, notwithstanding other current pressing health crises. Let us not let the moment go to waste. And apart from positioning the epilepsy agenda from legal and social perspectives within trending priorities, it is also paramount to identify and build social capital with key government departments that are responsible for the implementation of resolutions at the domestic level, and to fit this into political agendas by showing them how such actions can boost their international standing. Further, to encourage our leaders to recognize that 10 million is a lot of people, that anyone is at risk of developing epilepsy. And it is also important to see the interconnectedness between treatment gaps and the potential and unnecessary loss of participation of millions of people in social and economic activities when they are left out due to discrimination and the unaffordability and unavailability of epilepsy treatment, and how in fact non-prioritization is more costly than prioritization. Additionally, I think that it is important to call for greater attention in closing the treatment gap. Many people have spoken about, I think it was Dr. Vicki who mentioned issues of funding. And we can do this through subsidization of treatment sensitization campaigns and research programs, in the same way that treatment sensitization and research programs for communicable diseases are heavily subsidized and prioritized by our governments.
Thank you, Nkandu. We have one more question from the audience. I'll take that and then I'll come to Sharon. So this question is for Dr. Vicki and Dr. Florence. Any of you can answer. It's from Yusuf Nomamode in Mauritius. And Yusuf's question is, how do we synchronize political agenda integrating epilepsy? How do we synchronize political agenda integrating epilepsy? So Dr. Vicki or Dr. Florence, who would like to respond to that?
I can just do one or two lines on that and just perhaps say that what Dr. Florence has already been talking about is that the way that we have put together the agenda of mental health and the neurological disorders is already a huge start. And we have to reinforce that all along the way. And so that for me is a priority. It's about integrating healthcare. And we are no longer in the MDG silos. The Millennium Development Goals were wonderful in many ways, but we have many broken health systems because we've split everything into different treatment categories. And we need to relearn how to do that, particularly to primary level. And I'll stop there. Thank you.
Thank you, Dr. Vicki. And I will turn to Sharon. Sharon, as a person living with epilepsy, are you satisfied with the solutions that have been suggested here? Are there other solutions you would want to add? Maybe some things we missed out. Sharon, you have to unmute your microphone.
You'll excuse me for that. Thank you again, Comfort, and many thanks to my fellow panelists for their contributions. I'll just feed back some of what I picked up from Nkandu, the importance of commitment or efforts at an international level, and even the fact that if African countries especially were to prioritize epilepsy and integrate treatment even into the universal healthcare programs, that would actually boost their presence in the international community. From Dr. Vicki, the fact that you can't really take government head on. So there's a sense where you do need to work with like-minded people towards solutions for the problem. From Dr. Florence, the fact that WHO has already made strides in this area, developed a plan whose information will be shared by mid-April, and the fact that would actually be broken down to the national level. And so yes, I am excited about some of these solutions and possibilities mentioned here. I know our government has made some strides as far as developing a Kenya national guidelines for epilepsy. That was in 2014, whose main focus was person-centered care. And I think part of the challenge has just been that implementation since that time. So I'm thankful again for the contributions. I do believe those are strong working solutions towards just integrating epilepsy into the health agenda and increasing our efforts. Like Dr. Banda said, it's time to talk more. And so let's just all take up advocacy a whole other level. Thank you.
Thank you very much, Sharon. And our time is fast spent. We will be wrapping up. So I will give each of you 2 minutes for your concluding remarks and what's the way forward. Any comments? You have 2 minutes as we wrap up. I will start with Advocate Nkandu.
I'd really not want to take away anything from what has already been said by adding more. I'd just like to, I think, echo what everyone has said on the importance of concerted efforts and to move away from working in silos on issues that are as critical as epilepsy. And I'd like to just end off by thanking the Regional Committee for this platform and for putting together such a stellar and comprehensive advocacy toolkit, and also for recognizing the ways in which legal frameworks have tremendous potential to improve the lives of persons living with epilepsy.
Thank you, Advocate Nkandu. Dr. Vicki?
Thank you so much again for including me. I feel very privileged to be amongst my fellow advocates. I call myself an activist. That's how hard I've changed. So as an old lady, I'm now an activist, and I would toy if I could tomorrow, but my joints don't let me. So I think that what we're saying is that you have to speak up to your government. If you've got to get the facts, and you can use this toolkit to help you along the way. Implementation is a problem throughout. You can have lovely policies. If they're not implemented, it's useless. And so we've got to have the voice, and you've got to hold your government to account. And that might be tough. So thank you, and good luck with the toolkit. I'm putting it up on my website, so you will soon see it, I hope, flying out of the window. Bye-bye.
Thank you, Dr. Vicki, and Dr. Florence.
Thank you very much. I will echo everybody's thanks for being included on this excellent panel. I really enjoyed it. I would say that one takeaway that I would like to give is that the importance of the individual and the importance of civil society. So it's really important for the individual as well to go out and do what they can and speak out. And that's where the power of the toolkit comes in. But the toolkit is not really about working as an individual, working as just epilepsy associations, but seeing how you can form consortiums or other groupings that bring together different stakeholders so that together you all talk with one voice. This could be other people with disabilities. It could be others with other NCDs, including mental health conditions. It could be, you know, even for women, even for children, even for adolescents. But as long as you're coming together to work together towards one common goal, I think there's a lot of power in this toolkit. And I want to congratulate very much IBE-Africa as well as the Band Foundation for getting this out. Thank you very much.
Thank you, Dr. Florence. And Sharon, concluding remarks from you.
Yes, so first of all, thank you very much, all the team here who have enabled me to be on this platform. So again, I'll echo my panelists in that way. In addition to all the valuable closing remarks that have been shared, I think mine is the fact that we need to be empowered to tell our individual stories. There's so much power in sharing your personal story. I'm also a member of the NCD Technical Working Group for Advocacy. And so I'm just part of a big group that is all about pushing advocacy, all about pushing awareness. I congratulate as well IBE-Africa and all the partners and people who have been behind this toolkit. I recognize that it's used to help organizations put up ideas, put up inspiration to be able to take advocacy forward. And so mine is just to congratulate the team and to emphasize the importance of empowering all of us to share our personal stories.
Thank you, Sharon. And of course, there is power in our stories. If we do not share our stories, who will? And please permit me just recognize the president of IBE, Professor Martin Brody. He's with us in the chat, and President-elect Dr. Francesca. We're glad they could join us. This month was special. All our panelists were women. It's a special Women's Month. I want to wish all the women who joined us and those who are watching through the Facebook Live sessions, I wish you a happy Women's Month, happy Women's Day come Monday. And of course, we invite you all to look out for the announcements for the next webinar. Try to invite more people to join in, because when more people understand what our advocacy is about, they can do more. So please look out for the next announcement for the webinar series. Invite your friends. And if you are on social media, please, let's continue this conversation here. Let's continue to echo what we have shared here so that more people can join us. It's been a great pleasure hosting you all. And as we leave, I would hand over the microphone to Action Amos.
Thank you a lot, Comfort, and all panelists. And we want to thank all the participants, all the chapters present, WHO headquarters, WHO Afro region, and really appreciate your support. The Office of the Prime Minister in Eswatini, we thank you for the support. The Office of Presidents in Malawi for allowing us to have those two guests that we had. So with those words, we say thank you and see you again in our next webinar. Thank you so much. And not forgetting Dr. Professor Martin Brody and the President-elect Francesca. Thank you for supporting. Thank you.
Thank you.
And Band Foundation. Thank you.
Thank you.